The major hydration mistake that's slowly killing you. Did you know that dehydration can impair mental capacity, hinder digestion, and increase the risk of diabetes? Yes, something as simple as drinking water is essential to our health, but many people still neglect it. That's why today we're going to share important hydration secrets from Dr. Barbara O'Neill, which will help you hydrate the right way and avoid mistakes that can harm your health. Let's get into the information. Barbara emphasizes that water is the second vital element needed for life, with oxygen being the first. While breathing is involuntary and we do it all the time, many people still don't drink water correctly. In fact, where there's no water, there are usually no people living, right? I always ask people, how much water do you drink? And these are some of the answers. If I drink water, my feet swell, or if I drink water, I'll be in the bathroom all day. According to the doctor, this increased urination may indicate the real problem. Water isn't properly entering the cells. So what's the solution? Barbara highlights the importance of sodium and potassium, which are respectively the third and fourth vital elements for humans. When there's a balance between these two elements in the body, water is absorbed properly. The issue is that most people don't consume enough fruits and vegetables, which are great sources of potassium, while they consume too much table salt. In other words, while sodium levels increase, potassium levels drop, causing cells to swell and leading to high blood pressure. The doctor points out that by choosing table salt, people are consuming only sodium chloride, losing other minerals that are eliminated during processing. There's a French doctor who wrote an entire book about salt, saying, "When people come to me with hypertension, I introduce them to Celtic salt." Why Celtic salt? Because it's a hand-harvested sea salt that preserves over 80 minerals in its composition. Barbara highlights that this broad range of minerals in Celtic salt helps water enter the cells, promoting effective hydration in the body. To use Celtic salt, she suggests starting by placing a crystal the size of a sesame seed on your tongue, letting the mucous membranes absorb the minerals, and then drinking water to help hydrate the cells. And what do most people do when they feel tired? They take a break from work and quickly reach for a cup of coffee. But this could be a big mistake. We conducted studies on caffeine and found that it takes 5 cups of water to make up for the dehydrating effect of just 1 cup of coffee. So, people are not only not drinking enough water, but they're also dehydrating themselves with the beverages they consume. The doctor emphasizes that people usually associate dehydration only with a dry mouth, but she points out that excess saliva can also be a sign of dehydration. So how do we know how much water we should drink to avoid dehydration? According to Barbara, the calculation is simple. To know how much water should enter, we need to find out how much water is being lost. Normally, we lose about 1.5 liters through urine, 0.5 liters through skin perspiration, 0.3 liters through the intestines, and 0.2 liters through the lungs. Therefore, every day our body eliminates at least 2.5 liters of water, meaning we need to drink at least that amount for the body to function fully. The doctor highlights that many people end up consuming too much water at once, which can cause excessive urination and prevent the body from properly absorbing the water. To avoid this, Barbara suggests consuming 2.5 liters of water throughout the day and always using a crystal of Celtic salt before each glass for better cell hydration. And how can dehydration affect our body? It all starts in the digestive system. When we don't drink enough water, the mucous membrane lining our gastrointestinal tract can become dry and thin, reducing its ability to protect the stomach from acidity and hindering digestion. Without enough water, stools can become hard and difficult to pass, causing constipation. Additionally, the lack of water can reduce the production of enzymes and gastric juices, impairing digestion and the absorption of the nutrients we need. This can lead to abdominal pain, bloating, and digestive difficulties. In more severe cases, chronic dehydration can cause electrolyte imbalances and more serious metabolic problems, affecting our overall health and well-being. One of my patients, 60 years old, had suffered from stomach pain for over 25 years and was taking antibiotics to fight Helicobacter pylori. After 4 months of unsuccessful treatment, he came to me, and I was able to investigate the real cause of this problem. Barbara discovered that this man was drinking water at the wrong time. Instead of drinking between meals, he was drinking almost a liter of water with each meal. What's the real impact of this habit? When we smell food and start chewing, the body automatically releases hydrochloric acid into the stomach to start the digestion process. By pouring this amount of water into the stomach along with the food, the hydrochloric acid gets diluted and loses its digestive capacity, making the stomach environment more favorable for the development of Helicobacter pylori. When this man started drinking water at the right time, between meals, the stomach wall thickened, and the undiluted hydrochloric acid was able to naturally eliminate the presence of Helicobacter pylori. The body healed itself with proper hydration, without the need for antibiotics. Let me tell you about a man who came to our retreat with three main problems: chronic headaches, chest congestion, and intense lower back pain. Did you know that 75% of the weight your spine supports is held up by water? Back pain when we're dehydrated is quite common, and that was his case. When I spoke to him, I asked how much water he drank per day, and he replied that he didn't drink water, just Coca-Cola and coffee. At 46 years old, he was already taking a lot of painkillers, and his quality of life was low. We encouraged him to drink more water, and after a week, his headaches were gone, his back pain had considerably diminished, and his lungs were clearer. 2 months later, he showed up with a big smile and a 2-liter bottle of water, saying that he now drinks 3 liters a day. In addition to pain, Barbara points out that dehydration can even contribute to the development of diabetes. When we're dehydrated, the body struggles to maintain the proper balance of hormones responsible for controlling blood sugar levels, such as insulin and glucagon, which are produced by the pancreas. Without enough water, the pancreas can't function properly, and as a result, the production of these hormones can be compromised. This means that blood sugar is not regulated effectively, increasing the risk of developing diabetes. Dehydration can also significantly impact brain function, affecting both mental clarity and emotional state. When the body is dehydrated, the brain doesn't receive the adequate amount of water, which can reduce concentration, memory, and reasoning ability. Lack of water also affects the brain's chemical balance, contributing to headaches, fatigue, and even mood changes like irritability and depression. In more severe cases, prolonged dehydration can cause mental confusion and difficulty making decisions. These effects on the brain not only impair cognitive function but also affect overall well-being, making everyday tasks more difficult and negatively impacting quality of life. Many people living in special care centers for the elderly don't drink enough water, and this certainly contributes to mental illnesses and brain decline. In Australia, about 1,700 new cases of Alzheimer's are diagnosed each week, which is quite alarming. One of the cases presented by Barbara is a good illustration of how drinking the right amount of water can help the brain function properly. A few years ago, a 44-year-old woman participated in our program and brought her mother, who suffered from dementia. We explained that people with Alzheimer's or dementia need a caregiver because our program doesn't replace hospital care, but it teaches how to create the conditions for healing. When the mother, who was about 70 years old, arrived, she was just staring out the window and didn't seem to recognize anyone. Talking to the daughter, we found out that she hadn't drunk water in 2 days and was barely eating, which is quite common in people with Alzheimer's. We offered her some lemon tea and a bit of water, and the lady drank it. About 5 minutes later, she started interacting and talking to the people around her. I was amazed by her change, and I realized she was just dehydrated. Dehydrated people can suffer serious health damage, including constipation, metabolic disorders, mental illness, and diabetes. Dehydration can also result in complications in kidney and liver function, which can affect the entire body. So, don't make that mistake. Now I'm curious to know your experience. How many liters of water do you drink per day? Will you follow the tips we shared here today? Leave your answer in the comments and send this video to your dear friends and family so they can make the most of this important element in our lives. The water. Thank you very much for your attention, and until the next presentation. If you like this information, like it, share it with friends and leave your comment.